So hello, I'm Tim from Revitalis. I'm sitting here with Dr. Beck. He has his practice in Munich, 50 kilometers below Munich, I need to say. And I first want to make an introduction. Dr. Beck is 55 years old. He has his practice for more than 25 years. He treats around 40 patients a day and is specialized in chronic illnesses. Also, he gives lectures in Europe about informing people what's the cause of disease. So that brings me to the first question, Dr. Beck. Thank you for having me here.
Thank you.
I have the first question. What according to you, is the cause of the enormous rise of chronic disease in these days, these years?
Yes, I think the main two causes are on the first step. It's the huge lack of vital substances like vitamins, minerals, amino acids and so on, and there's nothing in our food, and so the body has a massive lack of these vital substances, and this is one main cause of chronic disease.
Mm-hmm.
Yes. And the second one is of course the high toxic input of pesticides, herbicides and other chemical products. Mm-hmm. And these two things, the low in vital substances and the high amount of toxic, these together in our body, our body is not able to function any longer properly, and these in 95% of my patients, these leads to chronic disease.
Okay, good. And what is the influence then of the environment on toxins on your health? Can you be more specific on that?
Yes, from the morning to the evening, we are living in a toxic world. We use our toothpaste, it's toxic. Yes? We need our deo, it's toxic. We live in rooms with furniture, it's toxic. We go to our car, our new car. Inside, we are driving to work or so on. The car inside, it's toxic. Mm-hmm. We eat food, it's toxic. We drink water, it's toxic. Mm-hmm. We have clothes, it's toxic. We have sun protection creams, it's toxic. Yeah, we wash our hairs, it's toxic. We give color to our hair, it's toxic. And this the whole day. And this huge amount, our body is not longer possible to get rid of these toxins. Mm-hmm. It's accumulated in our body, mm-hmm. and this is one of the main causes of chronic diseases.
Yeah. Okay. Thanks. So that brings me to the next question. What is, according to you, the best way to detoxify your body then? How can people do that?
Yes, to detoxify there are a lot of possibilities. One of my favorite is sweating. Yes, if you sweat, you get rid of the toxins via the skin. I have a special cabin, infrared cabin, mm-hmm. and there I sit 3 times a week for 45 minutes, and then the toxins come out. Mm-hmm. So this is it's a pleasure for me to go inside this cabin, and I can do a lot of detoxification. Other possibility is to make to eat organic food, mm-hmm. To make green smoothies with a high amount of vegetables, mm-hmm. and these vegetables have a high amount of chlorophyll, mm-hmm. and this allows my body to get rid of these toxins. Mm-hmm. Other possibility is to drink a good water, not tap water, good organic water. For example, of course, if you make sport and also sweating is also a possibility to get rid of toxins. These mm-hmm. are things it's easy to make, and there are a lot of other things, but to go in.
What for example do you use in your practice for detoxifying the body?
In my practice I have the heating cabin, the sauna, like a sauna. I have some food bath for detoxing. I make some wrapping with special oils to get the toxins, the fat-soluble toxins out of the body. I make special heating therapies. These are the main I do in my hospital. But the main detoxification and the most important detoxification procedures the patient has to do at home, because it takes 1-2 hours, and if he makes it 1, 2, 3 times a week, that's good.
Yeah.
But it's a must. In our world, you have to detox your body, otherwise you will get ill. Yes.
And people need to make different choices what they put on their body.
Yes, of course, they must be aware of what they eat, what they drink, what they put on the skin and put on the hair. It's really essential. And the native people, they know, for example, what you put on your skin. You must eat it. If you can eat your cosmetics, yes, then it's good for your body. But if you eat your toothpaste or if you eat your deodorant, you would be severely ill.
Yeah.
It's chemical and it's toxic.
Yeah. Okay. Which lifestyle habits do not fit in a healthy lifestyle? So what do you see with your patients? 3 lifestyle habits. What do you think? Stop it.
Yes.
Immediately.
Yes, that's one of the most important things is the lack of sleep. The people we must sleep 7-8 hours in a good place without WLAN, without all the electromagnetic waves and so on. This is very important. A good sleep, then a good food, good water, good relationship, and during the weekend no stress for sports and so on. In the weekend you have to make a private rehab. That means Saturday, Sunday, it's for you, for your body, for your health to come down, to come down, to relax, and so you have the possibility to have enough power for the week. But if you do a lot of work during the week and Saturday, Friday, Saturday, Sunday, also you have social invitations and this and sports and you're in competition and so no. During the weekend, you have to rest. It's difficult to accept. But it's my way to keep my body healthy.
Okay. In your practice, people come here, they are severely ill. Can you tell me why do you use the vitamin infusions above the vitamin pills in the beginning of a treatment?
Yes, because if a patient is severely ill, he has a huge lack of vitamins, minerals, amino acids. And of course, I want to replace these vital stuff in a very short time to improve the situation of the patient. And if I take pills, the most patients think if I take a pill, 100% of the pill, of the ingredients, is coming into my body. That's a very big mistake. It's a mistake because only 10% of the ingredients are coming from the colon, from the intestine, into your body. 90% leaves your body via the feces, and you have no success rate. So in the beginning, the most important thing is severe ill patients, they have a huge lack, and you must do IV trips. Later, after 3, 4, 5, 6 months, then you can change it and you can do oral use for capsules or drops or so. But in the beginning, if you are a healthy person, then you can say, okay, I do only my pills, capsule, drops. But if you have a severe chronic disease, yes, that means in the beginning to have very fast success, you have to do the IV trips.
Okay, good.
In the right combination, yes. IV trip is not IV trip, yes. In the right combination with the right ingredients, high quality, and so on.
Okay, good. What according to you is the best anti-aging strategy people can do?
The best it's of course sleep, enough sleep, good food, good water.
But if you're doing all that right,
yes.
What is the cherry on the top?
The cherry on the top, yes. It depends on the patient, but I can only say what I do. I like, for example, vitamin C is very important because it's very important for our vessels.
Supplements, you mean?
Supplements, yes. Vitamin C, OPC, for example, I like very much. Some herbs for the liver, because the liver it has to work very, very hard, and it needs a support every day. And then I for myself, I inject procaine. Procaine, it's well known. It's not cheap, and 40 years ago, a Romanian doctor, Dr. Aslan, they give the patient procaine shots or pills with good results for anti-aging. It's not expensive. It's cheap, and she had good results. Yes.
Okay, good. So I know you do. I've been here a few years ago, and you taught me something, and it's about iron.
Yes.
And that's a big problem, iron,
yes.
for mainly women with severe problems with their health, like fatigue, hair loss, nails brittling off, headaches, sleeping problems. Can you tell something about that?
Yes.
Why is that a problem?
Yes. That's really one of the biggest problem I see in my daily work. That I have a lot of women coming to me, and they are complaining about fatigue, about depression, about hair loss, about pain in the neck, about lack of concentration, and so on. And they go to the specialist, gynecologist, and to the specialist for other organs, and they find nothing. Yes, and then they make the blood test, the normal blood test, and you see they have a normal white blood count, normal red blood count. Yes, and then the doctor says, we can find it's you are healthy. We can't find anything. Yes, and nobody makes a special parameter. It's the ferritin. That's not the iron in the blood, in the serum. It's the ferritin, and then it shows me that these patients have, for 80%, have a huge lack of iron, and this iron must be given back to these women via IV drip. And I see a lot of miracles. It's really miracles what happens, that these women, they awake, they are after 4 or 5 in IV drips, they are happy, they're smiling, a lot of energy, they are no more depression, no hair loss, and they tell me, but why don't 95% of the doctors don't know that? Why is that's impossible? Yes, and it's really a disaster, because this iron lack syndrome, it's well known. For example, in Switzerland. In Switzerland, there are 10 or 15 centers, yes, for iron depleted women. And here in Germany, where I'm, a lot of 80% of the patient or 80% of the doctors have no idea about this syndrome, and you can help these women with easy IV drips of iron, no risk, needing no allergy, no risk, and after 4 or 5 weeks you have a complete change of these women, and they are very thankful for this thing.
Yes. We do that now for several years in our clinic in the Netherlands with the same success rate you taught me. So thank you for that. That's a great discovery, and I think many women can be helped with this simple treatment.
Yes,
of course.
Yes,
but do you have a new discovery? Do you have something? Another discovery, what you say about 95% is going wrong on that point, and this is a solution, a simple solution maybe for that.
Yes, what I see today is that many symptoms of the body have the main reason for many symptoms of the body is located here, yes. And I see that in the last 2-3 years we have learned a lot of our brain, a lot of our neurotransmitters, and I think in the next 5-10 years we will heal a lot of our diseases, our symptoms, not at the place where it happens. Otherwise we will heal it via the brain. And if you know that, you must imagine that I say to my patient a very easy example. I say, from here up to your toes, yes, all these bodies, the body cells, they are slaves. They have to do what here is decided. Here in your brain, everything is decided. The body temperature, your blood pressure, every hormone, everything you need for the cells, it's decided here. Here it's the most important center of healthy. And if the brain doesn't work well, yes, then you have big problems for the whole body, because all these cells, they have to do what's decided above. And now next is, we have found that we have not only a brain here, we have not only a brain in our head, we have a brain in our gut. And the connection between gut and brain, that means we have 2 brains in our body. One here in our gut and one here in our head. And these 2 brains, if we understand the connections between these 2 brains, yes, it will be an explosion in knowledge. And I think in 10-15 years we see our medicine from today totally different, and we can help patients with all diseases treating these 2 brains, nothing else.
Yeah, okay. I want to thank you very much for the interview. I think you're a great doctor. I've been here 2 times already, and I see amazing results you have with your patient. You're really treating the cause of disease and not the symptoms, without medication and with natural substances that don't harm the body. So I think you're doing great work. I think people should know about you and who you are and what you're doing. And I hope we can spread the word on this way. So thank you very much, Dr. Beck, and see you next time.
Okay, thank you very much too. Thank you.